Hi, I'm Camille Delgado, and today I'll be introducing you to the impacts that climate change is predicted to have on adolescent health. Throughout the presentation, you will see references to degrees Celsius, which is a simple measure of the level of climate change. According to NASA, the Earth was about 1.36 degrees Celsius warmer in 2023 as compared to pre-industrial levels, and the 10 most recent years are the warmest on record. As teens grow and develop, they actually breathe at a faster rate than adults, spend more time outside than adults, and drink more water than adults per pound of body weight. This puts them at unique risk from environmental hazards. The effects of climate change are profound in growing bodies like the adolescents that will be in our care as teachers. So let's explore a few of them. Poor air quality can arise from wildfire smoke, ground level ozone, and dust from droughts. Particulate matter like this is associated with an increased rate of respiratory conditions in kids whose lungs are still developing and who are more physically active than adults. Climate change is expected to increase rates of asthma. Over 4.2 million children in the United States suffer from asthma, and rates could rise by 11% at 4 degrees Celsius of global warming. Climate change will contribute to longer, more severe pollen seasons, which will lead to increased allergic illnesses. Asthma already accounts for 164 million missed school days each year, and this number could rise by 50% if we reach 4 degrees Celsius of global warming. This further affects the economy as caregivers may have to miss work to care for kids at home. Hospital admissions for asthma and other respiratory illnesses are expected to rise by 1 to 2% at significant cost to families. Extreme heat events are only becoming more frequent and lasting longer due to climate change. Compared to adults, children's bodies are not as efficient at thermoregulation. They also have reduced cardiovascular output and a higher metabolic rate, making them particularly vulnerable to heat-induced adverse health events. When a person is exposed to high temperature and their body cannot cool down, they can develop heat illnesses like heat exhaustion, fainting, heat edema, and heat stroke. Young athletes are particularly at risk as they exert themselves outside. High heat has myriad effects on young people. It's linked to poor cognitive function and concentration, which lead to poorer learning outcomes. It also affects the ability to have a good night's sleep, which is essential for effective learning. Children and adolescents will experience lowered activity levels as it becomes too hot or too cold to be outside, exacerbating our already worsening obesity and mental health crises. According to a 2020 report by the Government Accountability Office, an estimated 41% of school districts across the United States need to update or replace HVAC systems in their schools. And the EPA estimates that at current levels of AC in schools and homes, we can expect learning losses of 7% at 4 degrees Celsius global warming. This translates into an annual future loss of income across graduating high school students of $13.4 billion per year. Finally, the habitat ranges and seasons of insects and ticks are expanding due to climate change. Kids who spend more time outdoors are more vulnerable to illnesses like West Nile virus and Lyme disease. The last physical effect of climate change we'll explore is food insecurity. Children have a proportionately high intake of food as compared to adults, increasing their exposure and vulnerability to health threats. Rising levels of atmospheric CO2 reduces food quality and threatens availability for children. Extreme events such as drought or flooding can cause disruptions in food production or distribution, leading to increased cost and limited availability or access. This will be very relevant in California, which grows over a third of the country's vegetables and over 3/4 of the country's fruits and nuts. Finally, it should be noted that this will have the most pronounced effects on food insecure households, which accounted for 18% of households with children in 2023. So what can we do? Well, there's almost nothing that one individual or community can do to slow climate change, but we can still help our students as the problem worsens. There are numerous federal, state, and local resources available for those impacted by climate change. Keep your students aware of things like cooling centers that may open on the hottest days, food pantries for those experiencing food insecurity due to supply chain issues related to climate change, and help families who might qualify for PG&E's Energy Savings Assistance Program so they can keep their homes temperate. Every year, 175 million children globally experience a natural disaster. Exposures to traumatic events like natural disasters can impact children's abilities to regulate emotions, it can undermine their cognitive development and academic performance, and contribute to PTSD, anxiety, depression, panic, and phobias. As educators, we need to provide stability and compassion for our students when they need it the most. Finally, we're not in this alone. Organizations like NASA, MIT, and the National Oceanic and Atmospheric Administration regularly create new lesson plans that incorporate climate change scenarios. There are lesson plans available for every grade level and for multiple subject matters. Thank you for listening to this presentation. I hope it's been informative.